"66-year-old Yusuf Mukasa is a resident of Tebariala village in Luero district. He has 36 biological children and he has hopes for more. His argument is that the oldest will take care of the young ones and God okayed him to be all family planning. A number of Ugandans are just like Yusuf and they do have needs including health care.
My children are always sick and my current wife has been giving birth by C-section.
Healthcare is subsidized in government-run hospitals, so it was hard for Yusuf to be convinced to join a community health insurance scheme under Serve for Health Uganda.
I discovered its importance because at a government facility, you'll go in a long line and go away with only Panadol.
He used to buy most of the prescription drugs and ended up spending more than the premium he now pays for health insurance.
That is something small as compared to what they benefit, because someone pays that 30,500, but can access care up to 200,000 shillings.
Sometimes I take my wife and the bill is about 300,000, but I pay about 120,000.
This is one important step into achieving a new approach to health called universal health coverage.
If I could summarize it, access to needed health services of good quality in a manner that does not expose one to financial hardship.
That you are not selling your land and your cows and mortgaging your house to be able to afford the necessary health care in emergency, even when it is not emergency.
According to the World Health Organization, WHO, at least 1 billion people each year cannot obtain the health services they need. 100 million have been pushed into poverty after paying directly for health. This despite some governments like Uganda's that run heavily subsidized or free healthcare services.
Because what we provide, actually our package is essentially a minimum healthcare package. So there may be services beyond that, whether you are rich or poor.
Maternal health, that one we have not done very well at all. And that is one of the areas which requires a lot of serious programming and where probably universal health coverage will be very important.
And communities have to be involved.
Because the government pass is very limited, they also have different priorities that are driving towards sustainable economic development. And so the resources are scarce and sometimes you have to dig into your pocket.
This is one of the strongest recommendations of universal health coverage. Health insurance.
We have seen schemes where communities are able to build a house, like in Hoima, communities have built a house where a health worker can regularly come and provide health care. But we also have opportunities which are not utilized, the circles.
Dr. Grace, a health economist and focal point person for universal health coverage at WHO Uganda, says countries also need to tackle the social and economic determinants of health.
Sanitation, things like poverty, gender, the education status. If we ignore those things, they affect, because a mother who is not educated is unable to take care of a child's health as well as one who is educated.
Professor Sengoba, the lead investigator for the Supporting Policy Engagement for Evidence-Based Decisions SPEED project, says a conference to discuss UHC is on towards the end of the month.
When we bring all the stakeholders in Uganda, ideally it's not important to get people to get sick and then ask health sector to treat them. The idea is if we know education helps people to live good lifestyle and choose things that are helpful, how is the education sector preparing people to take good choices? If it is about nutrition, do we have an agricultural policy and intervention that speak to good nutrition, which food and all that? If it is road sector creating accidents, what are we doing? If it is policing borders and helmet, how can we achieve that?
The Minister of Health will not be left alone to address the causes of disease and mortality.
Universal health coverage is very much needed, especially for a country like Uganda. But it may not be possible to achieve without universal access, which according to the World Health Organization has 3 dimensions: physical accessibility, financial affordability, as well as acceptability.
UHC is one of the targets of Sustainable Development Goals, and it's anticipated to achieve what the health MDGs failed to achieve.
The roadmap is there in form of a health sector development plan.
Countries are expected to have resilient health systems which can withstand calamities including climate change and dangerous epidemics such as Ebola, which Uganda is susceptible to. Florence Nalimba, NTV.